Hello, and welcome. You are watching Step Up Medicine's series on cardiovascular physiology. In this episode, we're going to explain how arteries, especially the aorta, play a crucial role in regulating pressure and flow. We'll cover concepts like compliance, capacitance, and the Windkessel effect, and explain how aging affects arterial function. By the end of this episode, you should be able to define vascular compliance and capacitance, understand the role of elastic arteries in buffering pressure changes, explain the Windkessel effect and how it smooths blood flow, describe how aging affects arterial compliance and pulse pressure, apply these concepts to clinical scenarios, such as hypertension and arteriosclerosis.
Let's begin with compliance. Compliance is a measure of how easily a blood vessel stretches in response to pressure. It is defined as the change in volume divided by the change in pressure. In other words, a compliant vessel can hold more blood with less increase in pressure. Arteries are generally less compliant than veins, but large arteries like the aorta are still able to stretch during systole when blood is ejected from the heart. This stretch is essential for buffering the pressure surge and maintaining forward flow. Low compliance means a vessel is stiff and does not stretch easily. High compliance means it stretches more readily under pressure. Now let's talk about capacitance. Capacitance refers to a blood vessel's ability to store blood. While compliance describes how easily a vessel stretches, capacitance is about the actual volume it can hold. Veins have high capacitance. In fact, they hold about 2/3 of the body's total blood volume at rest. This makes them the primary blood reservoir. Because of this, changes in venous tone can significantly affect how much blood returns to the heart. This directly influences preload and, ultimately, cardiac output. In short, veins store blood and help regulate volume distribution.
Next is the Windkessel effect, a classic concept in cardiovascular physiology. During systole, the left ventricle ejects blood into the aorta. The aorta stretches to accommodate this volume, storing potential energy in its elastic wall. During diastole, the aorta recoils. This recoil pushes blood forward, maintaining blood flow even though the heart is not actively pumping. Nande hive. This is known as the Windkessel effect. It smooths out the pulsatile nature of cardiac output and ensures continuous flow to organs between beats. Without this effect, arterial pressure would drop sharply between heartbeats, and blood flow would become irregular. This elastic recoil is also crucial for maintaining mean arterial pressure, which is vital for perfusion. As we age, the composition of arterial walls changes. Elastic fibers decrease and collagen increases. This makes arteries stiffer and less compliant. Stiffer arteries can't expand as easily during systole. As a result, systolic pressure rises, while diastolic pressure falls. The difference between these two, the pulse pressure, becomes wider. This is why older adults often develop isolated systolic hypertension. Their diastolic pressure may remain normal, but systolic pressure climbs due to reduced arterial compliance. This also increases the workload on the heart, especially the left ventricle, contributing to hypertrophy and long-term cardiovascular risk.
Let's summarize the key points from this episode. Compliance describes how easily a vessel stretches in response to pressure. Capacitance refers to how much blood a vessel can store. Veins are highly compliant and serve as blood reservoirs. Arteries, especially the aorta, are less compliant but can stretch enough to reduce pressure spikes during systole. The Windkessel effect allows elastic arteries to stretch and recoil, helping maintain steady blood flow between heartbeats. With aging, arteries become stiffer and less compliant. This raises systolic pressure, lowers diastolic pressure, and widens pulse pressure, a common feature in elderly patients with hypertension. Clinically, reduced compliance increases cardiac afterload and impairs coronary perfusion, contributing to cardiovascular disease. Now test your knowledge with this quick question. Which of the following best explains why pulse pressure increases with age? A. Increased heart rate. B. Decreased blood viscosity. C. Increased arterial compliance. D. Decreased elasticity of large arteries. Leave your answers in the comments below.
Thanks for joining us for episode 6 of the Cardiovascular Physiology series. In the next episode, we'll explore venous return and preload, and how blood gets back to the heart to keep the cycle going. If this helped clarify your basics, like and subscribe for more high-yield videos. Thanks again for watching, and keep stepping up your knowledge.